Hello everybody, I'm Dr. Zorica Plavsic. I'm coming from Belgrade, Serbia in Europe, and I wish you all the best during this wonderful meeting. In the first place, I want to thank you, the organizer, for inviting me for this meeting, and I will present a paper, Apitherapy in Oncology. Does it work? Cancer is a global problem. In many countries, together with heart diseases, it is on the first or second place with regard to the leading causes of death. About 7 million patients die of cancer annually, and 25 million people are currently living with a diagnosis of cancer around the globe. Due to the fact that the average age of the general population is increasing, the global burden of cancer is also increasing. An average of 51% of cancer patients use some kind of alternative or complementary medicine. I prefer to say and use complementary medicine because of non-mainstream practice used together with conventional medicine. I also like to say that apitherapy is a part of integrative medicine, because the integrative medicine we can use these B products together with the conventional medicine without any side effects. This amazing small insect is preparing for us 8 different products in their hives. Each product contains bioactive components, 100 of them, which help us to be healthier, to prevent the disease, and to use it as a medicament for treating the diseases. Let's start with the honey. We can say that honey has anti-cancer mechanism and the effects of apoptosis of the cell, mitochondrial pathway, outer membrane permeabilization, anti-inflammatory, immunomodulatory effect, modulation of insulin signaling, and estrogenic activity. In anti-cancer effects, on the first place, the honey can introduction the apoptosis, death of the cells. Some of these biomolecules rise some actions in the cell, some decrease, but all of them are working synergistic, and the end effect is synergistic. Also, the modulation of oxidative stress, anti-inflammatory effects, anti-proliferative effects, immunomodulation effects. All of these keep us healthy, and these biomolecules work against carcinoma in the body through induction of apoptosis on the first place. The second product is propolis. He also has immunomodulatory activity, apoptosis or death of the cancer cells, cell cycle arrest, regulating some oncogenes, anti-angiogenesis, anti-migrative activity to prevent dissemination of cancer cells, anti-proliferative, cytotoxic activity, and anti-inflammatory activity. A group of authors in this study that was published in 2020 find and explain how propolis act against skin, prostate, breast, gastrointestinal, and oral cancer. All these activities of propolis are within the cancer cells or stabilizing the immunity of the body. Bee pollen also has anti-cancerogenic effect through flavonoids and phenolic acids, very active biomolecules from bee pollen. The anti-cancer impact of bee pollen administration is the stimulation of apoptosis, the inhibition of cell proliferation in multiple cell lines, and the reduction of tumor growth in breast and prostate cancer. Oral intake of royal jelly will work through tumor necrosis factor and transformed growth factor. Tumor necrosis factor produces anti-cancer effect, decreases in tumor size, and transformed growth factor slow down the adverse events like anorexia and fatigue. And the authors say that oral intake of royal jelly improves anti-cancer effects and suppresses adverse events of molecular targeted therapy by regulating TNF-alpha and beta in renal cell carcinoma. The effect of the synergistic interaction of royal jelly with anti-cancer drugs on the cancer cells was improved, as well as normal cells. In this paper, Nutrients, in 2022, this year, and these effects are reduced to reduce the cytotoxicity in the normal cells and to increase the apoptosis of cancer cells. Bee venom acts through dendritic cells to stimulate the immune system, through which it activates cellular immunity. Its antioxidant activity is associated with a reduction in reactive oxygen species and elevation in antioxidant enzymes, which leads to protection against cell death, protection from apoptosis. Bee venom, the active biomolecule is melittin from bee venom, and is considered cytolytic but non-specific to cell. Melittin has the ability to suppress tumor growth in breast, liver, prostate, and lung cancer cells. In vitro and in vivo studies show that melittin can suppress growth of cancerous cells by inhibiting NF-κB signaling and activating caspase 3 and 9 pathways. Inhibition of hepatocellular carcinoma cell motility was observed in vitro and in vivo by suppression of RAC1 dependent pathway. Next several slides will present the current research on different cancer cells with bee venom, but all these studies are in vitro studies. In the studies of ovarian cancer cells, bee venom caused apoptotic cell death by increasing the expression of that receptors and inhibiting the JAK STT-AT pathway. This pathway plays a central role in the survival and embryological processes and may show abnormal activity due to some genetic mutations, polymorphism, and alter the functioning of the pathway, leading to the development of cancer, so bee venom can be used in the prevention of development of cancers. Whether the growth of human cervical tumors was inhibited by bee venom on mice, it was investigated and it was found that tumor growth was inhibited as a result of the inhibition of nuclear factor kappa B by increasing that receptor. This paper was published in 2015. In leukemia, in a study conducted on human leukemia cells in 2020, it was stated that melittin induced apoptosis in leukemia cells and could be a therapeutic agent in the treatment of leukemia. The anti-cancer activity of bee venom has been demonstrated in the human lung cancer cells line by introducing apoptosis and inhibiting the expression of cyclooxygenase in human lung carcinoma cells. It thus seems that bee venom may have an anti-tumor effect of a human lung cancer. Unlike some non-steroid medicaments, bee venom was not observed to inhibit COX-1, and it is possible that it will not incur the serious adverse effects such as peptic ulcer formation and renal dysfunction associated with the COX-1 inhibition. In vitro study conducted in 2018, authors examined the effect of bee venom on colon cancer cells. It was shown that apoptosis was induced and colon cancer cells growth was inhibited by activation of dead receptors and inhibition of nuclear factor kappa B. In the conclusion, I will say that the level of knowledge of the patients about apitherapy is quite low, only 41%, and they receive the information they gain from their family or friends in 63, almost 64%, not from the doctor. The rate of use of apitherapy products by patient is also low, 27.6%, and the most frequently used product is, as you all know, honey. Healthcare professionals should conduct more scientific research on the use of apitherapy products in cancer treatment and inform patients about use areas of apitherapy. More clinical studies are needed for the development of apitherapy in oncology. Thank you for being here, and I would like to be in touch with all of you, and here are my address, phone number, email, and website. Thank you again.